We also know that there's some studies which investigate the potential antidepressant effect of ayahuasca. And we had these two studies, the two preliminary studies, which were open label design, which shows here, we can see that in this y-axis, we see the severity of depression. So bigger are these numbers, most severe is the depression, and here we observe the time. So we see in both of these studies that ayahuasca, only one dose of ayahuasca starts to diminish the depression severity already few hours after intake, and this effect lasted 21 days. So these two studies are very encouraging, but they had a limitation, as they did not control for the placebo effect, which is large in depression. So in order to address this issue, we performed a randomized clinical trial, placebo-controlled, which had the main objective to evaluate the antidepressant of ayahuasca, but also to study some acute and subacute effects. So here you can see the trial design. So after the participant selections, the patients underwent a washout period from about 2 weeks, and then took place the experimental session. This session, so the whole experimental session took 4 days, and in the first day, the participants were evaluated by several kind of evaluations, since psychiatrical and neuropsychological assessments, fMRI, and sleep EEG. Then, in the next day, we collected saliva and blood samples, and in this day took place the dosing session, in which the participant could take either ayahuasca or placebo. In this day, at the end of the day, the participant went home, and the next day they came back to the hospital, and we performed again all these evaluations from the first day. Some details about the trial. So we used a parallel arm design, in which 50% of the participants took ayahuasca, and the other 50% took placebo. We used 1 milliliter per kilogram of ayahuasca or placebo, and besides the 35 patients with treatment-resistant depression, we also had a control group composed by 50 healthy volunteers. So here it's only to give you an idea from the trial complexity. So we start with a lot of participants, and at the end, after screening and applying the exclusion criteria, we ended with 14 patients in ayahuasca group, 15 patients in placebo group, and 23 participants in each group for the controls. So dosing session took place in this room, and during all the session, participants were monitored by EEG, and also we collected saliva samples for cortical dosing, and we performed psychiatric assessments, used some scales to assess depression and other psychiatric conditions, and at the end of the session, we applied some questionnaires to assess the psychedelic effect. So what we can tell you about the acute effects. So first of all, we assess the cortisol, the salivary cortisol, and we observed that both patients and controls had increased levels of cortisol after intake, which corroborates some previous findings. We also performed some preliminary analysis in this electroencephalography data, and we also observed a decrease in alpha band mostly in occipital and temporoparietal regions, which also is a common find with ayahuasca and also with other psychedelic substances. Regarding the subacute effects, which are like 1 day after the dosing session, first of all, we wanted to assess the safety of ayahuasca, and we dosed a lot of some biochemical markers in order to assess like kidney function, liver function, and immune system function. And what we can take from this picture is nothing is changing. So there is no significant changes 1 day after ayahuasca. We cannot observe any significant changes in any of these parameters. We also evaluated a resting state network called salience network, which is a network involved in interoception and also affect. And it's composed by 2 regions, mostly by the anterior cingulate cortex and the anterior insula. So for this, we use the fMRI data, and using the seed approach, we first identify this salience network, which is here shown in yellow and orange. And when we compared the health volunteers from the ayahuasca group and the placebo group, we observed that there is an increase in functional connectivity from the ACC, so the anterior cingulate cortex, in the ayahuasca group. And interesting, this increase, this functional connectivity increase, is correlated with some acute experience, some somesthesia effects that the participants experience during the acute effects. So here we are correlating some change that happen during the acute effect with this not long term, but this subacute effect we see 1 day after. So here is the correlation in ayahuasca group, and we did not observe the same for the placebo group. To finish, about the antidepressant effect, so we show that ayahuasca has an antidepressant effect starting 1 day before the dosing session, and this effect is large 7 days after, and also that participants in the ayahuasca group who had more changes in perception during the dosing session, so changes in perception acutely, correlates with improved symptoms in depression. So better, the participants were 7 days later. They had greater changes in perception during the dosing session. But we also wanted to understand from where this antidepressant effect is coming. So in order to try to better understand this effect, we also measured cortisol's level 1 day after. And we see first that at baseline, we had patients with depression had lower levels of cortisol than controls. And after, 1 day after, we see here that in the placebo group, the patients still have this lower level of cortisol, but in the ayahuasca group, we did not observe this. So ayahuasca now is equal or not significantly different from the controls. And also, we assessed the brain-derived neurotrophic factor, BDNF, which is an important molecule which plays an important role in depression. And we see here, at the baseline, we had also patients had lower level of BDNF than controls, And so one day after dose session, we had like increased levels of cortisol for the ayahuasca group when compared to the placebo group. And this effect was like both for controls and patients. So we had like increased cortisol, increased BDNF levels. But only for patients, what we see here is that there is a correlation between the cortisol level and the severity of depression. So bigger the cortisol level, lower is the depressive symptoms. So this is what's quickly, we have like some perspective, and the perspective is keeping analyzing the data. So we have like a lot of data to analyze already, still. And it's this. So I want to thank our team here. It's like a huge project with a lot of people involved. And most like I showed here works from these students and my collaborator, Lorenzo. And it's this. Thank you very much.
Now we have time for questions, if anyone will please.
So, my understanding is that, super thorough, but I had to go off of the SSRI to take ayahuasca. My understanding is that this SSRI curve, it boosters my personal experience. Drops and you don't have other support, then people, I mean, it's easy to document something immediately after. The question is then, what is the support and what's needed after 21 days? Also, what is the effect of ayahuasca on dopamine and other serotonin-related precursors? And how are they affected by ayahuasca, and then not having ayahuasca or any other agent in your body to support you?
So yeah, so yes, so DMT is mostly serotonin agonist, so it's increase the serotonin levels, and it's an interesting question because we know that most SSRIs do not work like immediately. So you have to take 2 weeks to have this effect. And it's why we are like investigating to know how could be possible to ayahuasca to make people better just like few hours or one day after. I don't have the answer, I don't know why it's happening. What we think maybe it's related with this mystical experience. So at the end, okay, it's a molecule, but we don't know. Maybe it's the experience at the time that makes this change. And about these other receptors, dopamine, yeah, the beta carbolines are also monoamine inhibitors, so they should have this more general influence on these other dopamine or adrenaline, other neurotransmitters. But I don't know if that's some studies like addressing specifically how ayahuasca changed dopamine. I'm not aware if there is someone like studying this. Yeah, but it should be it should be done because we know that so depression, we don't know already, like there's a lot of hypotheses about why depression is happening. So there's this neuro serotonin decrease levels, but no one is sure if this is causing depression. Like there's some inflammatory cytokines also hypothesis. So I think it's not clear if it's only the serotonin levels that make people depressed, and also others biomarkers, cortisol and BDNF and TNF-alpha and these others interleukins should be also assessed to see if there is changing in others parameters also, and should be. Yes.
I have two questions. One is, what was the setting of the administration? Was there any psychotherapeutic accompaniment was there any psychotherapeutic accompaniment during or after the ayahuasca administration? What was the context? And the second is, what was the placebo made out of?
Okay, so for the first one, no, it was not. We had no psychotherapy associated with the administration of the substance. It was like only the substance. At the beginning, we gave some instructions to the patient, to the participants, like to pay attention on their own body sensations, emotions, but it was like this, and also to have an intention for this moment. But it was like personal. We didn't ask about, and we only say, okay, maybe it's good if you have something to think about during the process. And for the placebo, so one thing I forgot telling you, it was like everyone was naive. So every participant was like, they never took ayahuasca before. Because we know like that ayahuasca is very strong and has a very strong taste and smell. So it's very hard. If you already taste ayahuasca once, it will be very hard to mimic ayahuasca. So for the first, we had like only naive participants, and then we make a substance based on zinc sulfate, yeast, I don't know if it's yeast, I know, and acid citric to mimic like some bitter acid, and also some brown colorant to make similar, like look similar. And also this zinc sulfate provokes like a little gastric discomfort, also to try to mimic this kind of effect ayahuasca could provoke also.
Hi. I was a little bit confused by your cortisol explanation. It's my understanding that cortisol has to do with the fight or flight, so increased anxiety, and so I don't understand how ayahuasca, how it's beneficial to have higher cortisol. I thought the benefit is to lower your cortisol so that you're not always in fight or flight. You give your body a chance to rest.
Yeah. Right, like for us was also a surprise when we did these baseline comparisons between controls and patients, and for our sample, we find that patients had lower levels of cortisol. And at the literature, normally we associated depression with higher levels of cortisol.
Right.
But it seems that if people are depressed for a long time, as is the case of our participants, like they were having depression for around 7 years or even more. So it seems that you can experience some habituation effect. And at the beginning, like cortisol was high, and after time, like as they was not getting better, we can see this lower level of cortisol. But this is specific for our sample. So as our sample was like lower than controls, so for getting better, it's like if you normalize the levels of cortisol, it's better. So it's why like it's relative. It's not like absolute, how I say, comparison. It's like, in this case, comparing our patients with our controls, as at the beginning, the patient was like lower level, it's better if they increase the levels to be equal with the controls. Understand?
I do,
Yeah,
but
it's like,
to me,
yeah, but it
doesn't make sense.
I think it's tricky. It's not. Yeah, for us was also a surprise at the first time we see this data, but yeah, and it seems it's not. There's a lot of different reports regarding cortisol. As also, it depends a lot of what time of the day we measure the cortisol, because there's a large variation with these circadian rhythms.
Right.
We try to collect always like 7 in the morning, but yeah, could be also some issue about this measure.
So the cortisol went up in the patients that took ayahuasca.
Yeah.
Is that correct?
Yeah. A little bit also. It's not like a huge effect. Yeah.
Okay.
Thank you.
Sorry, we don't have time for more questions.
But I will be there.
Yes.
So thank you.
Thank you. So.